prostate cancer is full of uncertainties. It's also full of preconceived ideas. When we started the intergroup study back in the mid-1990s, there was a general feeling that this was a group of patients with locally advanced disease. They were a bad group of patients. They did badly. They probably already had microscopic metastatic disease, even though you couldn't see it, and there was just no point in giving them radiotherapy. And so the common treatment was just hormone therapy, ADT, androgen deprivation therapy, alone. And there were even feelings that radiotherapy was somehow terribly toxic and really a very unkind thing to do to patients. That's one aspect which has struck me about this. Of course, what we found in this study was that not only is radiotherapy very beneficial in terms of reducing the risks of dying of any cause, overall survival benefit, but also a 43% reduction in the odds of dying of prostate cancer at 7 years. And that's a pretty big risk reduction. So not only is it effective, but actually looking at the toxicity, this really isn't a toxic treatment. So the notion that radiotherapy shouldn't be given because it's toxic just isn't true. So this was a randomized trial. It was taking the view that the standard treatment for these men was hormone therapy alone, ADT, androgen deprivation therapy. So the randomization was to ADT versus ADT plus radiotherapy to the prostate, or to the prostate and the pelvis. So it was a simple trial design. It was important to do it that way round because other trials that had been done at the time were only looking at the question of patients who were actually already getting radiotherapy and asking whether adding hormones to their treatment was beneficial. And it was, but it didn't answer the question as to whether the benefit was due to the hormone therapy by itself or something about the combination of the radiotherapy. It didn't tell us what the contribution of radiotherapy was. So what this study has done is to show quite clearly that radiotherapy is beneficial, and that's without doubt, really. I very much hope that this will change practice, because there's still quite a strong view that for a lot of men, hormone therapy alone is adequate treatment. And I just don't think that's true. I think the data shows that if a man is fit enough to have radiotherapy, he really ought to have radiotherapy in addition to hormone therapy. Now, not every man is fit enough for radiotherapy, that's absolutely true, and there may be some patients for whom other things need to be considered, that's also absolutely true. But if other things are equal, the standard treatment, the gold standard for men with locally advanced prostate cancer is hormone therapy plus radiotherapy.